Renowned oncologist Dr. Anna Mary Nyakabau, who has spent over 3 decades treating cancer, carries the emotional scars of a profession defined by far too many losses.
When I see very young patients, say a mother with young children who has advanced cancer, and that cancer is the one with a bad prognosis, and the woman does not have support, it becomes very difficult. And another reason why I ended up also trying to look at maybe helping with fundraising is when you find that they don't have the means. My hope and wish is that one day we will be able to treat cancer patients without them having to think about financing the treatment out of pocket. With programming in terms of us making sure that we reduce the numbers through raising awareness, screening, early detection, we will have less patients.
Nurse Murio Njerere describes a mental battle waged silently beneath her uniform.
At times you reach a point where you want to cry, but you always remind yourself that, remember, you're a professional, somebody. But inside, you are really crying.
Even the act of informing patients of their diagnosis requires highly specialized emotional skill. Recognizing this, Dr. Nyakabau returned to school to study palliative care, simply to learn how to communicate without destroying hope.
Because the patients were coming as advanced stage cases, you had to know how to communicate with them such that you don't break them. So breaking bad news is one area that needs to be mastered by all healthcare workers, because it can literally destroy the patient, even one who has got a good prognosis. So there is need for training of healthcare workers.
Cancer care demands emotional endurance that few can sustain. Hence, professionals are calling for psychological support programs to help them cope.
It's something that really needs to be looked into proactively in terms of programs that care for the carers in our country, because sometimes these are the very reasons why we might be having brain drain, not because people are worried about the salaries or whatever. They're just not coping with maybe too much grief. So care for carers programs will be useful.
As cancer cases continue to rise, the resilience of oncology staff remains critical to the health system. Their compassion fuels hope in worlds where uncertainty is constant. But hope alone cannot protect them from heartbreak, because sometimes even heroes need someone to hold them up. Abigail Tembo, ZBC News, Harare.